night.
It feels like I have water in my ear that won't drain out.
She had infection of the ear canal.
An ABC 27 special presentation.
She was expecting to fly for a great scuba diving adventure.
Soon, quickly, now, getting the care you need when you need it. Sponsored by Penn State Health.
Good evening, I'm Amy Kem. Penn State Health is committed to getting you the care you need when you need it. But how fast do you need care? What do you do when you have an acute injury or a life-threatening illness? To find out, we'll spend the next half hour discussing when you need help, soon, quickly, or now. Tonight, we'll also discuss how to choose between primary, urgent, virtual, and emergency care so you can get the health you need to live the way you want. And if you have questions, you can join the live web chat right now by visiting abc27.com SQN chat. We'll share some of your questions later in the show. Well, up first tonight, Penn State Health Medical Group recently opened a new location in East Pennsboro to make sure that West Shore residents get the Penn State health care they need to live the way they want. Joining me now is Dr. Heidi Hutchinson. She's primary care physician for Penn State Health Medical Group. She's going to talk about the soon part of tonight's show. Doctor, since many things were put off this year, I know, like something that many people may need soon are their health care screenings. And why is that so important?
Yeah, thank you so much for having me on this show tonight. I'm really happy to be here to talk to the community. So you bring up such a great point. A lot of patients with COVID have really delayed a lot of their preventative care and their primary care. And it's just so imperative that patients get back to their primary care provider and get established. There's so many things that we do outside of acute illness, and we want to make sure we're caring for the patient in the community well. And there's a lot of preventative things that we can do from a primary care perspective to screen and prevent illnesses that really don't need to happen. We have a lot of screenings for mammogram, colonoscopy, we do blood work for cholesterol and blood sugar, and talk about depression and anxiety. And there's just so many things that I think are lapsed because of COVID in general. And we just really want you to come back to our primary care practices so we can address those concerns and really help you with those care needs, because we really want to make sure we're caring for you guys, you know, the whole spectrum of what your needs are, not just the COVID care spectrum.
How important is to find a family physician that you really trust?
That's such a great question. I think having a trusted primary care provider is one of the most important things that you can do as a patient. Having that close connection with a primary care who you can talk to and really confide in, and really allows you, I think, to have better access. It motivates you to come to the doctor and bring your family. It motivates for your friends to come. I also think it really carries over into just overall wellness and health, because you have a doctor that you trust, and when you feel well cared for, I do think it carries over into all aspects, including wellness, mental health, emotional, physical, and just having that trusted provider really makes a big difference.
Very good. Well, thank you for being here, Dr. Hutchinson. We're going to see you a little later in the show. You're going to answer some viewer questions for us. But right now, we are going to hear from Denise McCracken. She has the story of a woman who almost missed out on the trip of a lifetime. Denise.
Thanks, Amy. Yes, a York County woman developed ear pain just before a long-planned scuba trip. She needed to see a doctor quickly, so Jeanette Whitman made the decision to go to Penn State Health Urgent Care. Here's her story. Learning how to scuba dive was on Jeanette Whitman's bucket list.
I always wanted to see what it was like underwater. It seemed like a fascinating thing to do.
Last year, Jeanette got certified.
I just got to a point, I'm 52 years old, and decided one day, well, I'm not getting any younger, so I might as well do it. So I just decided during the pandemic to go ahead and do it.
A certification that opened the underwater world to Jeanette. So she booked a scuba diving trip to Honduras.
Honduras has the second largest Great Barrier Reef in the world, and that was intriguing enough to me.
Less than a week before the trip, Jeanette noticed a possible complication.
I had gone to Michigan to visit relatives, and they live on a lake, and was swimming in the lake and ended up getting water in my ear. It just felt like it was staying in my ear. I wasn't in any real pain or anything, but knowing that I was going scuba diving the following weekend, I was very concerned about it. So I gave it a couple of days to see if it would, go away, and it didn't. So made the decision to go to urgent care.
Jeanette decided to visit our urgent care in Camp Hill with a concern of pain and also decreased hearing in one ear. Our physical examination showed that she had infection of the ear canal, what is called technically otitis externa, aka swimmer's ear. But the problem is that sometimes this infection can convert into the infection of the inner ear. And because of that, she was placed on antibiotic.
So Tuesday, I got the drops, 4 drops in my ear 4 times a day.
In several days, I made a follow-up call to make sure that the treatment is going in the right direction because if the infection would extend to the inner ear, that would definitely disqualify her as a scuba diver for an entire week.
After the first couple of doses, I felt a difference in my ear, and they felt good.
Jeanette was given the thumbs up to go on this once-in-a-lifetime trip.
I think I wasn't planned for my first scuba diving trip until the following Sunday, so it gave me some time to work with the drops beforehand. And then I just continued to use them. I'd get up, put them in my ear, go out for 2 dives, come back, put them in my ear, go out for another dive, come back, put them in my ear, and then put them in again right before bed. So that became my life.
A life that was made possible because of a wise decision to seek care urgently.
I would do it again. I'm hoping I have many more trips to go on.
We're happy to report that Jeanette's trip went well and she didn't have any problems with her ears.
Thanks so much, Denise. Recently, Deborah Pinkerton spoke with Dr. Walker about Jeanette's case and when someone should seek urgent care treatment.
Dr. Walker, our show is called Soon, Quickly Now, and quickly represents urgent care. Jeanette needed urgent care. Talk to us about some of the other services that you offer there.
Our 2 urgent cares, one in Camp Hill and one in Carlisle, can provide the services for a variety of medical problems. Going from the top, this could be a contusion, concussion. This can be foreign body in the eye, any nasal congestion, soreness of the throat, cough, shortness of breath, low abdominal discomfort, diarrhea, urinary problems like burning on urination, suddenly frequent urination, any STD problems, vaginal discharges, joint pains, any cuts and bruises, small burns. All those things can be managed by our urgent cares.
Wow, so there's certainly a wide variety. Anything else that you offer to the community?
Yes. Part of our urgent care system is specifically in the urgent care in the Camp Hill is a large travel medicine clinic that provides services for all those people who are planning to explore the world, offering counseling regarding anti-malarial protection. Also, we provide vaccinations like typhoid fever, meningococcal vaccinations, hepatitis A and B vaccinations. Also, we provide advice regarding yellow fever vaccination or no vaccination for all those who are planning an international trip.
Now, many people may be wondering about COVID-19 testing. Is that something that you can do at urgent care? And how do you go about doing that?
This center has ability to provide the rapid COVID testing through the test that's called antigenic test. If the test is negative, we follow with the second test, and that's a PCR test, as it's recommended usually. To schedule an appointment, if you are asymptomatic and to be seen by our providers, the only thing that you have to do is to call our registration line or just walk in.
And one question that I know parents may have, it's sports time, school's getting ready to start. Many people need to get the PIAA forms filled out for their children. And is this someplace where you can go to urgent care to get that taken care of?
Absolutely. We do fill out those forms. We specialize also in the, many other physicals, at least most of the pre-employment physicals, most of this other school physicals, college physicals. Some can be a little bit more complex, but majority of them we can handle over here. We also provide the injury care for work-related injuries, we always do the initial visits in our centers, and we refer people to the proper clinic that is authorized by the employer.
Okay, Dr. Walker, thank you so much. This is information we certainly need to know.
Excellent. Hey, thank you for having me.
And thank you so much to Deborah. Joining us now is Tammy Tallis. She's the Director of Virtual Care Operations for Penn State Health. And Tammy, Penn State Health has been really a leader in telehealth since before the pandemic. But why is it so important now for patients really to be able to access care from anywhere? I mean, tell me about your role there.
Absolutely. Penn State Health has opened its virtual door back in 2012, introducing Telestroke, and has continued developing and implementing virtual care plans across the Penn State Health enterprise, partnered hospitals, and community outreach programs.
You recently started something called the RPM program. It's remote patient monitoring. How does that work?
Yeah. The RPM program, Remote Patient Monitoring Program, is a virtual service. It allows our medical staff to monitor patients' health status remotely. Not only is this program convenient for the patient who are being monitored in their private home, it is designed to support patients staying on target with their personal medical management plan.
So what sort of patients are we talking about? Who qualifies for this?
Currently, we have two use cases, our COVID patient population and our Penn State Hershey heart failure group. We are in the plans of implementing a couple more use cases, and we hope to have that out in the near future.
And so far, what have you seen in terms of outcomes with these patients?
I think about our COVID population. Our COVID patients, they're recovering from home. They're isolated. As you can imagine, this can be a really scary time for these folks. And we've had patients along with caregivers reaching out to us, just so thankful for this program and grateful that they could be part of this program. I truly believe that the remote patient monitoring program has been a lifeline for some of these folks.
Tammy, that's so encouraging to hear. Thank you so much for joining us tonight.
Thank you.
Oh, you're very welcome. For more information about Penn State Health, or if you would like to schedule an appointment, call 866-519-2357 or visit online at pennstatehealth.org. Well, later in the show, we'll take a look at what kinds of situations call for emergency care. But coming up next, we'll hear more about telemedicine and how it is being used to get patients the care they need when they need it.
You're watching Soon, Quickly, Now, getting the care you need when you need it on ABC 27, sponsored by Penn State Health.
Welcome back. Joining us is Dr. Krista Flitch, Vice President and Chief Medical Information Officer for Penn State Health. We just talked about the RPM program. That sounds like a huge success. I mean, you have seen outcomes for yourself. Talk about that.
Yeah, it's great to have me back on here, Amy. Penn State Health's really proud to provide the service to our community. Our hospitals in all the counties in the area. Our patients that get great care for people who live here. But we all want to be at home when it's safe. And what this RPM program does is allows us to care for patients at home to be safe. They're monitoring your oxygen, they're monitoring their temperature, heart rate, blood pressure, all those things. And actually, I was lucky enough to enroll the first patient when I was taking care of a COVID patient in the emergency department, and he was scared, just really worried, and didn't meet quite criteria to come into the hospital. So we were able to enroll him in the remote patient monitoring program, and we watched him for 30 days. And actually, when he went home, his wife found out about it, and we enrolled her virtually. So we actually shipped that home. So both of those family members who were really frustrated and went to a couple of different facilities here, we were able to monitor them for 30 days, and I think they felt a lot safer.
Yeah, I bet they did. And this virtual care, I mean, it seems like it really fits into that like soon, quickly, now category. Tell us how virtual care really has grown over, say, the last 2 years.
Tammy did a nice job of talking about us first starting off in the telehealth space, but really the Penn State Health On Demand app with the free coronavirus screenings, the urgent care offerings, and the scheduled virtual visits during the peaks of the coronavirus pandemic. We've now expanded to this RPM and really opening scheduled visits for specific specialties, because we're listening to patients who live and work with us here in central Pennsylvania, and they're asking for these services, and we're happy to provide it to them.
I understand you can now do self-scheduling, and that's for neurology virtual care. How does that work?
Yeah, so it's really interesting. We heard from both actually dermatology and neurology patients that it's really kind of tough to get in sometimes, and really sometimes just getting in is the key. So both our neurology departments and dermatology departments have offered online self-scheduling through our Penn State Health On Demand app. If it meets the criteria, they'll see you virtually, and it's an easier way to get into those specialists.
In your opinion, what does the future look like for Penn State Health and telehealth?
Yeah, Penn State Health believes virtual care is here to stay. Direct care, remote monitoring, RPM, all of those activities are really mainstay of a new and modern healthcare delivery system. We've got specialists who can see in the office. You can do remote consultation, and I think that's the difference here. We work here, we live here, you're our neighbors, our specialists are here, and we're just advancing these technologies to get the care you need when you need it.
Well, thank you so much, Dr. DeFlitch, for all this important information. Always nice to talk with you.
Thanks, Amy.
Well, for more information about Penn State Health, or if you would like to schedule an appointment, call 866-519-2357 or visit online at pennstatehealth.org. Let's check in with Denise now to answer some viewer questions. Hey, Denise.
Hi, Amy. Here to answer those questions is Dr. Heidi Hutchison, primary care physician for Penn State Health Medical Group in East Pennsboro. Doctor, our first viewer question is, what kind of questions should I ask when I'm trying to find the right fit for a physician for my family?
That is such a great question. I'm going to answer that with what I look for myself and my family. I think first and foremost, seeking somebody who is knowledgeable and has the education to take care of you and your family is very important. I definitely feel very passionate about looking for somebody that offers just extreme empathy and compassion for caring for patients. It is so important that the patient feels that they're cared for, not just that they are a number. And that is extremely important, especially now with COVID. Patients are really suffering with a lot of issues, and they really just need that person that, they feel that they're getting the care and they feel that the doctor really wants to help them or the provider wants to care for them. The other thing I think is really important is just really somebody that listens. Listening is one of the most important feedback I get from my patients, and they all appreciate that I take the time to listen. At times I do run behind because of that, but it's so worth it when I know that I'm caring for the patient. So I think just seeking a provider that will really sit down and listen with you is so key. And lastly, just seeking kindness all around with what we're searching for currently with everything. Just finding those kind hearts that really are there to help you through all of your healthcare needs, I think is really important. So for me, those are the most important things I think I would recommend for my patients as well as for me and my family.
Those are great tips. Our next viewer question is, we know men typically put off going to the doctor, but why is it so important for them to get their yearly checkups?
Yeah, that's a good one. I got a giggle on that one because I do have a wonderful husband who fits into that category. So hopefully he's not watching, but I don't want to embarrass him. But yeah, I mean, a lot of men typically do delay care more. And what I hear a lot from them is, my wife sent me here. And I say, oh, okay, is there any issues? And they're like, no, I feel great. I don't know why I need to come. And I think a lot of the perception, again, not just for men, but people, is that when they feel well, they don't need to be seen. So I always try to reinforce and educate the patients to say, we want to care for you when you're sick, but we really want to care for you when you're well too. It's just so important to get those preventative screenings like we talked about before, and just caring for patients all around with their whole aspects of health, I think, are key in general. So that's kind of what I reinforce with the patients when they come in, is we want to see you when you're well so we can really do the best we can to be optimal to take care of you and your families.
Dr. Hutchison, thank you so much for answering our questions tonight. And Dr. Hutchison will answer your questions until 8. So if you have a question, you can join the live web chat right now. Go to abc27.com/SQN chat. Back to you, Amy.
Thank you, Denise. Joining us is Dr. James Leeming. He's the Director of Emergency Medicine and the VP for Medical Affairs for Penn State Health Hampton Medical Center. Doctor, the emergency room, it's really the now in the soon, quickly now. When should someone go to the emergency room?
Yeah, thank you for having me on this evening. It's one of the questions that a lot of our patients struggle with. There's lots of guidelines out there that try to help patients understand when they should come in. But I have a general rule of thumb. If you're not sure that you should be coming to the emergency department, you probably need to. I find that patients who take that as a way of looking at things are oftentimes well satisfied with the care that they receive. Patients who have minimal symptoms that oftentimes can be grouped together might have something that is a serious condition that's underlying, and the emergency department is the right place to be for them to get the care that they deserve.
Now, is this true? Because so many people put off screenings last year, and it makes sense, that they did, but now you're seeing more serious illnesses in the ER. Is that happening?
So anecdotally, we do have many examples of patients who put off their evaluation due to concerns about being exposed to COVID-19. And in doing so, illnesses such as heart attacks, strokes, heart failure, or appendicitis presented later in the disease than we would want. And our worry, of course, is that their outcomes were worse as a result of this delay in evaluation. We recognize that COVID-19 in our communities is a continuing evolving issue and represents a significant concern for our communities. This also is the same for our hospitals, and our physicians on the front lines have put in place protocols and safety measures to ensure that when our patients come to our hospital, that they don't have to worry, they can be confident that they don't have to be exposed to COVID-19.
Now, next month, Penn State Health will open the new Hampton Medical Center on the West Shore. There will be a new emergency room, of course, to care for patients. So talk about that new facility.
Yes, so I'm proud to say that Penn State Health listened very much to our community and what they needed. And they've built a beautiful hospital on the West Shore for our neighbors and our community members. The emergency department specifically will have 3 care initiation areas to greet the patients when they come to our hospital. We have 4 results waiting area locations for them to wait for results that are pending for them. We have an 18-bed treatment emergency department with 2 resuscitation bays that will help us manage the seriously ill and injured folks, and 10 beds in a clinical decision unit that's adjacent to the emergency department as well. Hampton Medical Center has been outfitted with some very fabulous technology, CT scans, MRIs, ultrasounds, and all the technology that we need to ensure that the high quality care that we want to deliver for our patients coming to Hampton Medical Center will be available to them.
When people think about Penn State Health, they really think about excellence. Talk about how everyone there works as a team after the emergency room visit to make sure patients get the help they need to live the way they want.
Sure. I think honestly that should be the goal we all strive for. And I can say that when I think of Penn State Health, I think of excellence as well. The plan in establishing a hospital on the West Shore was to ensure that the communities of the West Shore had greater access to the world-class care that's available within Penn State Health. But it's not just about Penn State Health. As you said, after patients come to our hospital, we want to ensure that we have a link to the ability for our patients to go back to their community physicians, their community providers. And in doing so, the care that we've started in the hospital can be continued upon returning. We want to be a trusted partner with our community physicians and providers to continue that long-term relationship with their patients.
Very good. Well, Doctor, thanks so much for being part of our program tonight. Well, if you would like more information or you would like to schedule an appointment with Penn State Health, call 866-519-2357 or visit online at pennstatehealth.org. That number again is 866-519-2357. And now joining us again for an update on the COVID-19 situation, we're talking with Dr. DeFlitch. He has the latest on the surge of COVID-19. Ugh, I don't like that we're talking about this, but what are you seeing?
Yeah, I don't like that I'm back talking about this again either, but the reality is we're in another surge, and this is all the Delta variant. We're seeing it more frequently with younger populations, and honestly, this is the disease of the unvaccinated. We're seeing the ill being younger and sicker, and it's all because of this Delta variant and not getting vaccinated.
Well, yes, so we're hearing so much about that Delta variant. Why is this so different?
Yeah, we talked about it in the past, but this variant of the COVID-19 coronavirus is more infectious. So it seems to be inhabiting the nares and the throat of people who are even vaccinated. And then whenever people are around who are unvaccinated, it's passing from the vaccinated to the unvaccinated. When the unvaccinated get it, they're more likely to get sick. They're more likely to get hospitalized. They're more likely to die. And so that's why we really have to protect ourselves, even if we're vaccinated and we're in public areas, that wearing a mask helps you not transmit it. But it's much more virulent or much more infectious than the other variants.
And then just very quickly, Dr. DeFlitch, what advice do you have for viewers at home listening to this tonight?
Yeah, one word, get vaccinated. It's safe for you. It's safe for your family. It's safe for your neighbors. It helps you and it helps the entire community out. So I can't stress enough, please get vaccinated. If you have questions, ask your provider. It is a safe, effective, and efficient virus. Please get vaccinated.
Very good. Thank you so much for being part of the show.
Thanks, Amy.
Good to talk with you. Well, we want to let you know our next Penn State Health special will be prostate cancer, a matter of facts. That's Wednesday night, September 22nd at 7:30. You'll meet patients whose stories illustrate the importance of early screening for this deadly disease. Again, that's prostate cancer, a matter of facts. September 22nd at 7:30, right here on ABC 27, sponsored by Penn State Cancer Institute. Before we go, we want to thank Jeanette Whitman for sharing her story and you, the viewers, for sending in your questions. And we send a special thanks to all healthcare employees who are working during this pandemic. Thank you so much. Thank you for watching tonight. We wish you good health.